What happens to your sputum sample for TB testing? When you go for tuberculosis testing, the process starts with collecting a sample of mucus from deep inside your lungs. This is usually done by asking you to cough deeply and spit the sputum into a sterile container. It's best to do this early in the morning because your secretions tend to be more concentrated after a night's rest. If coughing up sputum is difficult, a healthcare provider might help by having you inhale a saline mist to stimulate production. In rare cases, they might perform a procedure called a bronchoscopy, where a thin tube is inserted into your lungs to collect the sample directly. Once the sputum is collected, it is carefully sealed in a sterile, leak-proof container to prevent contamination. The sample is then transported to a laboratory, ideally within 24 hours, to ensure the bacteria remains valuable for testing. If immediate transport isn't possible, the sample needs to be refrigerated to keep it fresh and prevent other microbes from growing. At the lab, the first step is usually a microscopic examination. A small amount of sputum is spread onto a slide and stained with special dyes, such as the acid-fast stain. This helps highlight the presence of Mycobacterium tuberculosis bacteria, which appear as bright red rods under the microscope. This quick test can give an initial indication of whether TB bacteria are present. Next, the sputum undergoes culture testing. A portion of the sample is placed onto special media that support the growth of TB bacteria. Because these bacteria grow slowly, it can take from 6 to 10 weeks to get results. Culturing is very important because it confirms the diagnosis and allows testing for drug resistance, which helps determine the most effective treatment plan. In addition to microscopy and culture, molecular tests called nucleic acid amplification tests are often used. These tests detect the genetic material of TB bacteria directly from the sputum sample, providing results much faster than culture. They can also identify resistance to certain antibiotics, which is crucial for guiding therapy. Throughout this process, laboratory staff follow strict protocols to ensure the accuracy and safety of the testing. They check the quality of the specimen and take measures to prevent contamination. Combining microscopy, culture, and molecular testing gives healthcare providers a comprehensive picture, making it possible to diagnose active TB accurately. From the perspective of TB as a disease, the sputum sample is vital because it contains the bacteria that cause infection in the lungs. Proper collection and testing are essential for confirming whether someone has active TB, choosing the right treatment, and monitoring how well the treatment is working. This process helps control the spread of TB and ensures patients receive the care they need. In summary, your sputum sample for TB testing is collected from deep lung secretions, carefully transported, then examined under a microscope, cultured for bacterial growth, and tested with molecular methods. This combination of tests allows doctors to accurately diagnose TB, determine drug resistance, and plan effective treatment. Always remember to consult healthcare professionals for personalized advice and follow their guidance throughout the testing process.